Thank you for joining us for the St. Louis Metropolitan Pandemic Task Force Daily Briefing with Dr. Alex Garza. The briefing will begin shortly. Dr. Garza will take questions that have been submitted by members of the media after he makes brief remarks. Reporters who have questions during the briefing may also submit those to the task force public information contacts, and we will attempt to address them during the briefing or as quickly as possible after it concludes. I'll now turn the briefing over to Dr. Alex Garza. Thank you.
Okay, thank you and good afternoon, everybody. I hope you had a great weekend, and if you're like me, you're able to get some new blisters on your hands from working in the yard. So I want to thank the people of St. Louis region for your continued diligence and all the steps that we're taking to flatten the curve and bring our infection rate down. These evidence-based measures are really making an impact, and that's critical now. And they'll continue to be essential as we plan for the gradual and safe reopening of the economy in St. Louis. As healthcare professionals, I certainly understand how critical it is to reopen the economy. And as I've said in the past, we really have to do this in a very thoughtful and careful way to avoid that rebound in the virus. I know some parts of our state have opened, but I think as everybody knows, St. Louis is certainly the hotbed of activity in our state. And so it's important for us to maintain our social distancing, do all those other things that we've advocated for just a little bit longer because of our high rates. And it's really the right thing to do for just a little bit longer until we can make sure that we're ready to go ahead and reopen the economy. Now, we are making progress in lowering transmission, and we're hopeful that our hospitalization numbers will continue to come down more quickly. So as we plan to reopen the economy, we can do it in a really smart, gradual, and safe way. So I do want to share one update regarding the format of our briefings going forward. So this week we'll provide our live briefings and answer questions from the media on Mondays, Wednesdays, and Fridays. And then on Tuesdays and Thursdays and over the weekend, we'll be providing press briefings. So you'll receive an update from the Task Force Daily, but the format will just change a little bit. So now let's go and start looking at our numbers. So we're starting with this slide. This is the 7-day moving average of hospitalizations, and it shows that the number of patients in the hospital, that includes today's numbers, and that's both confirmed positive COVID patients and patients under investigation who do not yet have a confirmed positive result. But as you can see on the graph here, we're still at a little bit of a plateau. We continue to see progress. The trend line is really what we want to see start moving down, and we believe it will. Today's COVID and PUI, or patient under investigation census, is 653, and that's the lowest that it's been in a week, so that's really encouraging. And you can see from the daily number is below our 7-day moving average, and we want to keep that line coming down in the days ahead, so certainly some encouraging numbers. Now, moving on to our next slide, we're also encouraged that our 7-day moving average of new admissions has fallen gradually since early April as well. So on April 9th, that 7-day moving average stood at around 59. And today the average is down to 43, and that's a really encouraging trend as well. And so just so you know, the new hospital admission data is more timely than the hospitalization data, because it just shows those new admits coming in every day. And so we're really hopeful of this trend line, and it will be an important and timely indicator as we're looking to reopen the economy and then moving forward. So we need to continue to bring those numbers down, and that's going to require the diligence and vigilance of everybody for the measures that I mentioned earlier. And I'm really asking everyone to keep up that great work, and it is making a tremendous difference. So let's move on to today's hospitalization numbers now. So we have 653 persons hospitalized that, again, are either COVID positive or patients under investigation. And we had 660 yesterday, so again, it's coming down again. There are 164 ICU patients, which is slightly up from 158, and that number's been holding fairly steady. We had 110 patients on ventilators, which is down from 117, and that number has been holding fairly steady. And now for our good news slide. 24 COVID patients were discharged yesterday, and this brings us to 1,422 patients who have been discharged from our hospitals since the first confirmed positive COVID patient. So in summary, as we move to reopen the economy, we have to do it in a really smart, gradual, and safe way. And that allows us to protect our workers, our healthcare workers, customers, and everyone else in the region, and gives people the confidence that they need to really re-engage in the economy. So let me close by reminding everyone of the importance to follow the guidelines, wash your hands, clean surfaces, calling your provider if you're feeling sick. These are all critical steps in keeping our infection rate low. And so now I'd be happy to answer any questions from the media.
Robust contact tracing is continually mentioned as a key to safely reopening the economy. Does the St. Louis area have strong enough contact tracing in place?
So the St. Louis area, of course, the public health departments do the contact tracing, and they've done a very good job of doing that during the times of COVID. So, but as we know, we're going to have to ramp up that ability to do even more contact tracing, especially once testing becomes much more available. If you think about it, the more testing we do, the more positive patients we're going to find, and that means the more contact tracing we're going to have to do. And so the health departments are right now trying to bolster their ranks for doing that, but they've been doing a good job so far.
Every day on television, we see places in China or Europe spraying down public areas with bleach or other chemicals. Mm-hmm. Will we see a sanitation effort to this degree in our own areas of public transportation, buildings, or other places where the public may have to congregate despite social distancing guidelines?
Well, I believe you're already starting to see that, and just if you're out at the stores or at other places where you need to go and get essential things, you'll notice that people are a lot more diligent about wiping down surfaces, whether those are the keypads for the credit card machines or the door handles or anything like that. So and I don't see that changing in the foreseeable future. And so yes, I do believe that as businesses begin to reopen, things like that, you're going to see a much more concentrated effort on making sure those surfaces are cleaned.
As the state of Missouri opens up and the weather gets nicer and warmer, what are your recommendations to people in the city and county who are still under stay-at-home orders? Specifically, what are the health risks during this sensitive time of, saying, traveling to a winery for the weekend or to a community outside of St. Louis that may be open again for business?
So it's always tempting to get out and do the normal things that we like to do in life. So the way I would answer that is anytime that we're doing things that increase our risk of transmission, that's what it does. So when we're out in the public, out doing social gathering, things like that, you're always increasing that probability of transmitting virus. And so I would ask us just to make sure we're staying diligent, maintaining social distancing, all of those things, for just a little bit longer until we can safely say that it's time to relax some of those requirements.
What trends would you like to see happen in St. Louis City and County before recommending reopening?
Yeah, the data that we've been following is it's a pretty solid data path, and so you've heard me talk about following a number of cases before from testing. That's always challenging because the testing data comes in at different time intervals, and so it's tough to see trending on those. So I believe our hospitalization data is a good metric. Our looking at our index rate for admissions, I think, is also a really good metric. And so doing that 7-day averaging of both of those metrics, I think, are really good markers on how is transmission going in the community. We also, have some other data efforts ongoing. So we're continually trying to look at different ways of looking at the data to see if it's telling us something different, like where are the hot spots in the community? Is this a community spread, or is this from a concentrated area, something like that? And so So we're continually looking at the data to see if there's something that's even better that we can use, but right now those are our two solid ones.
Thank you. That concludes the list of questions received from members of the media prior to and during today's briefing. As Dr. Garza mentioned, tomorrow the Task Force Public Information Officers will issue updated numbers via press release and will resume our next in-person briefing on Wednesday afternoon. Thank you for tuning in.